I'd like to go ahead and have the Secretary please take the roll.
Representative Bentley. Representative Bowling.
Here in the room.
Representative Bray. Representative Birch. Representative Dotson.
Present in the room.
Representative Elliott. Representative Fleming. Representative Frazier Gordon. Representative Marzian. Representative Gibbons Prunty.
Here in the room.
Representative Rayburn.
Here.
Representative Raymond.
I'm here in my annex office.
Thank you. Representative Riley. Representative Sharp.
Present.
Representative Sheldon.
Here.
Representative Tate. Here. Representative Weber.
Here.
Representative Westrom. Representative Wilner.
Here in the room.
Chairwoman Mosier.
I'm here. Okay, we have a quorum and are duly established to do business. I know that we do have some members who will be in and out to other committee meetings and bill signings, so we will go ahead and get started. If I could just ask everyone to take a seat and silence your phones, and we'll go ahead with Senate Bill 105. I think Representative Frazier Gordon, you are presenting, and please introduce any guests and proceed.
Thank you, Chairman and members of the committee. Representative Deanna Frazier, District 81 in Madison County, and I'll let my
Can you pull your microphone just a little closer, please?
Yes, Representative Deanna Frazier Gordon, District 81, Madison County, and I'll let my guests introduce themselves.
Sarah Roof. I'm representing Kentucky Hands and Voices, a statewide organization that supports families of children who are deaf or hard of hearing.
And I'm Sarah Strevel. I am Bella Dawn's mother and the voice behind this bill.
Thank you. Senate Bill 105 basically includes CMV, cytomegalovirus, testing as part of the newborn screening program and requires the cabinet to provide educational resources. Congenital CMV is the most common congenital viral infection in the United States and the leading non-genetic cause of hearing loss. 1 in 200 children born with congenital CMV each year, and 1 in 5 of those will develop permanent health problems. This equals to about 270 Kentucky children annually and 55 with permanent disabilities. Every pregnant woman is at risk at acquiring, but only about 9% of women know about it. With proper prenatal education, women can learn simple and effective measures for this preventable virus. With expanded screening efforts, more children can be identified, leading to more timely access to early intervention and improving their outcomes. This bill's in memory of Bella Dawn Strevel, her mother is with me today, who passed away on April 7th, 2020 from complications related to CMV.
Motion on the bill.
Okay, we have a motion and a second. Mrs. Strevel, I just want to thank you for being here today and bringing all of the awareness to CMV, and certainly want to honor Bella and just make sure that we are improving our informational and awareness campaigns, getting correct information out to individuals, and some early testing. So thank you for all of your efforts.
Thank you so much for having me. I appreciate it.
Of course. Is there anything that you'd like to add before we take a vote? No? Okay, thank you. And I know that we've had great presentations in the interim and have learned a great deal from you, so thank you. We do have a couple of questions. Representative Bentley?
Thank you all for bringing this to the public and to here for a vote. CMV has been around a long time, and our killer cells, CD4, is what kills it in the body. And so this is really needed, these screenings are, to bring us up to date and save a lot of lives. So thank you very much.
Thank you.
Thank you, Representative. Representative Marzian?
Thank you, Madam Chair, and thank you for this bill. I really appreciate it. I was wondering, is the woman, pregnant woman, screened during pregnancy for this as well, or do you know?
Not currently, no. Only if there are complications, and a lot of the times only if you ask for the screening. It is possible to be screened, but it's not currently done. It's not typical.
Can I ask one more question? So, back from my kidney transplant days, I can remember we screened everybody for CMV, IgG, IgM, and it seemed like about 80% of the population had previously had CMV at some point, because it feels like the flu. So this would have been a positive infection at the time when the delivery happened. Would it have been that?
Actually,
or do you know?
Actually, the complication comes if you contact CMV for the very first time during the pregnancy. So if I was already positive for CMV before I became pregnant, the risk is much.
You would have been
much-
fine.
Yes, most of the time. It is possible to have a reinfection.
Correct.
But mostly that doesn't affect the child.
Right.
It's when I come in contact with CMV during the pregnancy for the very first time. So we would love for pregnant women to be screened at some point. And if that is ever to happen, what we would want is to screen them. And if they are positive, then they will know their risk factors. And if they are negative, if they have never had CMV, they're going to know that they're at a higher risk. So they're going to know to take more precautions, to monitor the pregnancy more, possibly do testing at birth, that kind of thing.
And that's too why we believe strongly in the education piece of this
Right.
bill as well, because it can be largely preventable if pregnant women take proper precautions, and so that's the education component as well.
Madam Chair, could I ask one? That brought me another question.
Yes, ma'am.
So if you do test, if you're negative and you should happen to find out that you do test positive, is there any kind of antivirals that you could take during pregnancy that wouldn't affect your fetus? Or
They're
do you know?
working on that. I'm not sure that those are CDC approved yet. However, there's some studies being used. So they are trying to use the same viral components that they use, their antivirals that they use after birth, which would be the valcyclovir or ganglocyclovir. They are trying to use those during utero to see if that will affect, but it's still kind of in the study phase currently.
Thank you so much. I've learned a lot today.
Thank you. And I believe that some mRNA vaccines are being looked at as well. And I do have a quick question. Do you know if the screening is covered by insurance
The screening after or before?
for the newborn?
I'm not sure. I know that's something that we've been working on. I think it can be included in part of that, if I'm not mistaken, after the baby is born.
Okay. All right. Thanks. We might want to look into that.
Yeah.
Okay. Seeing no further questions, we do have a motion and a second on the bill. Madam Secretary, please take the roll.
Representative Bentley? Yes, ma'am. Representative Bowling? Yes. Representative Bray?
Yes.
Representative Birch? Representative Dotson?
Yes.
Representative Elliott?
Aye.
Representative Fleming? Aye. Representative Frazier Gordon?
Yes.
Representative Marzian? Representative Gibbons Prunty?
Yes.
Representative Rayburn?
Yes.
Representative Raymond?
Yes.
Representative Riley? Representative Sharp?
Aye.
Representative Sheldon?
Yes.
Representative Tate?
Yes.
Representative Weber?
Yes.
Representative Westrom? Representative Wilner?
Yes.
Chairwoman Mosier?
Yes. Senate Bill 105 passes with favorable expression. The same should pass on the House. Thanks very much.
Thank you.
Congratulations. Thank you. Okay, next we will take up Senate Bill 173. Please introduce yourself for the record and any guest and proceed.
Thank you, Madam Chairman. Jason Howell, Senate District 1. I have Dr. Lori Earnshaw from Hospice Health here on the online to answer any questions. This is the medical order for scope of treatment bill. All this does is it takes what we already do on directions for end-of-life care and treatment issues that is in a paper form now and gives us the mechanism
Motion
to...
on the bill.
Okay. We have a motion and a second, and I do know that these are very simple changes. It simply translates from English to Spanish when needed and puts it online.
Yeah, thank
as
you.
I understand. Representative Marzian.
Thank you, Madam Chair, and thank you for this good bill. I had a text to see if we could, why nurse practitioners and physician assistants weren't able to sign the most order. I think that's right. And if they do in other states, I think almost all other states, and I wondered if that could be added at some, maybe on the House
It
floor.
certainly is. This is an evolutionary process, obviously, as everything is, as we move
good
more to
bill.
digitization, and that's certainly something I think we should look at.
Thank you so much.
Thank you. Okay, seeing no further questions, we have a motion and a second. Madam Secretary, please take the roll.
Representative Bentley?
Yes, ma'am.
Representative Bowling? Representative Bray?
Yes.
Representative Birch? Representative Dotson?
Yes.
Representative Elliott? Representative Fleming? Representative Frazier Gordon? Representative Marzian? Representative Gibbons Prunty?
Yes.
Representative Rayburn?
Yes.
Representative Raymond?
Yes.
Representative Riley? Representative Sharp?
Aye.
Representative Sheldon?
Yes.
Representative Tate?
Yes.
Representative Weber? Representative Westrom? Representative Wilner?
Yes.
Chairwoman Mosier?
Yes, ma'am. All right. Senate Bill 173 passes with favorable expression. The same should pass on the House. And I thank you for this great legislation. Congratulations.
Thanks, Madam Chair, members of the committee. Appreciate your time.
Okay, thank you. Next, I think I'll take up Senate Bill 178. I see that Senator Adams is here and everyone's here, but I think this is going to be a quick presentation. Okay, just introduce yourselves for the record and proceed when you're ready.
My name is Julie Rocky Adams, State Senate District 36, and I will not speak so that my fancy guests can talk to you all.
Hi, I'm Jessica Burke. Oh, I'm sorry. Thank you. I'm Jessica Burke. I'm the Senior Vice President for Legal and Government Affairs at Addiction Recovery Care.
I'm Tim Cesario. I'm the current chair of the Kentucky Board of Alcohol and Drug Counselors.
Yeah, go ahead. Thank you for having us here today. This is a cleanup to last year's CADC bill. That bill last year created the updated requirements for certified supervisors for CADCs and also the licensed alcohol and drug counselor credential. What the board discovered when they went to grandfather in existing supervisors was that there was some language missing that they needed. And so I'll turn this over to the board, but basically what this does is allow the board to grandfather in existing supervisors for another 90 days to a year after this bill takes effect to give everybody time to meet the updated requirements. The bill last year gave a year to meet those requirements, but as we all know, the last year has been a little unusual. So this grants more time to grandfather those in. Without this bill, we are not going to have enough CADC supervisors, and that
Motion on the
will.
bill.
Second.
Okay, we have a motion and a second on the bill. Do we have any questions? Okay, well, thank you. Madam Secretary, please take the roll.
Representative Bentley?
Yes, ma'am.
Representative Bowling?
Yes.
Representative Bray? Representative Birch? Representative Dotson?
Yes.
Representative Elliott? Representative Fleming?
I appreciate Senator Adams delegating her speech to someone else. No. Aye.
Representative Frazier Gordon? Representative Marzian? Representative Gibbons Prunty?
Yes.
Representative Rayburn?
Yes.
Representative Raymond?
Yes.
Representative Riley?
Yes.
Representative Sharp?
Aye.
Representative Sheldon?
Yes.
Representative Tate?
Yes.
Representative Weber? Representative Westrom? Representative Wilner?
Yes.
Chairwoman Mosier?
Yes. Okay. Senate Bill 178 passes with favorable expression. The same should pass on the House. Thank you so much. Okay, next we will take up Senate Bill 68.
Madam Chair, I'd like to record my attendance.
Where are you?
And also a yes vote on Senate Bill 105 and 173.
Thank you so much. Welcome. Introduce yourself for the record and go ahead when you're ready.
Thank you, Madam Chair. Ralph Alvarado, State Senate 28th District. Thank you for being willing to hear Senate Bill 68. Senate Bill 68 requires the Department of Medicaid Services to it requires them to procure an independent service to ensure the accuracy and integrity of Medicaid's new single PBM, as well as the Medicaid fee-for-service PBM.
Sorry, I didn't have my microphone on. We do have a committee sub. We have a motion on the sub. And do we have a second? Second. All in favor of adopting the committee sub? Aye. Any opposed? Okay. Is there anything that you'd like to add?
I've said enough, Madam Chair.
Okay.
Clearly.
Well, now I will entertain a motion on the bill. We have a motion on the bill and a second. Are there any questions? Representative Bentley.
Thank you, Madam Chair Lady. Could you explain the sub to us, Senator?
Certainly. So my understanding, the sub adds language from House Bill 222, which the House passed, that limited the compensation to the contracted entity, and it removes the 5-year experience requirement, so that they're really the only two changes in the sub, is my understanding.
Thank you.
Sure.
Representative Sheldon.
Thank you, Senator Alvarado. Yes, we do need some monitoring. We have one. The good news is when we passed it here, we had a bunch of them to look after, but we do have a single PBM that handles the entire state. I think this is very important that we keep monitoring that. Through that whole bill, it talks about underpayments and traditionally you've been a big supporter of PBMs and at least PBM reform. I guess I should reform. Yeah,
I was going to say not exactly of the PBMs, but I knew what you meant, Representative. Yes,
I hope so.
Yes,
I hope so.
Yes.
Yeah. Yeah. Matter of fact, you don't have to look very far. I think it's called 457.
Yes, I understand.
But yeah, you've been a big supporter and always been on our side trying to get that under control. This is just another measure. So again, sometimes there's roadblocks, but I know it's not you. I know you're a big supporter of ours in this area, and I appreciate this. So thank you very much.
Thank you, Representative. Just to comment on that, I mean, this bill is really very similar to House Bill 222, which was passed by this body last year. I know that Representative Bentley and yourself had proposed it. There was a bit of a delay last year just because we wanted the PBM to be rolled out. Now that it's rolled out, we're bringing this back to you. So this really is your labor more than anyone else's.
Thank you very much, but we appreciate you bringing it. And like I said, dynamics have changed, but this certainly can't help. And we'll appreciate 457 anytime.
Absolutely.
Thank you.
Okay. See no further questions. I want to thank you for your work on this. I know that we've had quite a few conversations just getting it right, and I think we have. So, Secretary, please take the roll.
Representative Bentley?
Yes.
Representative Bowling?
Yes.
Representative Bray? Yes. Representative Birch? Representative Dotson?
I appreciate my senator. Big yes.
Representative Elliott? Representative Fleming? Aye. Representative Frazier Gordon? Representative Marzian? Representative Gibbons Prunty?
Yes.
Representative Rayburn?
Yes.
Representative Raymond?
Pass.
Representative Riley? Yes. Representative Sharp?
Aye.
Representative Sheldon?
Yes.
Representative Tate?
Yes.
Representative Weber? Representative Westrom? Representative Wilner?
Yes.
Chairwoman Mosier?
Yes. Senate Bill 68, as amended by the committee sub, passes with favorable expression, and the same should pass on the House. Thanks very much again.
Thank you.
I guess just stay put for Senate Bill 66, Chairman Alvarado, and introduce your guests.
Again, Ralph Alvarado, State Senate 28th District.
I'm Stacy Burnett from Lexington, Kentucky.
John Burnett. John Burnett.
Thank you, Madam Chair and members of the committee. I'm pleased to testify today to ask for your consideration on Senate Bill 66. This past interim, I had the pleasure to meet Ms. Burnett, and she's a family practice nurse practitioner who reached out for a meeting to consider drafting legislation with regards to educational requirements for coroners. Her story is a sad one and a bit tragic, and I'm going to let her provide her story here if it's okay with you.
So this was my son, Nathan Burnett. He was a senior at Henry Clay High School. And last year on spring break, he had gone with his best friend's family to Utah on a snowboarding trip. And on March 30th of last year, my husband was outside with our two boys, and I was walking outside in a coroner's van, pulled up to our house. Sorry, I get very nervous during this. And he simply handed us this little piece of paper, and it had our names wrong on it, but it had our son's name and a sheriff's phone number in Utah. And he was a coroner, so we obviously knew that our son died, but he wouldn't even answer that question. We asked him if our son was dead multiple times, and he said he had no details whatsoever. Sorry. Just to call Utah. So he handed us this note and then walked away and left me obviously upset and screaming in the lawn, and our son's observing it. And my husband had to call Utah and get all the details. He didn't give us any instructions on how to bring our son back or how to arrange anything. He just left. And when we looked up legislation or looked up rules for coroners, there's basically zero bylaws about how they're educated on death notifications.
So unfortunately, Ms. Burnett's story is not really unique. In the recent past, we've heard of a death notification that occurred in another Kentucky county, particularly Jefferson County, where the decedent's family was not present when the coroner went to their residence, so the information was pinned to their front door. And that story also made the news after it had occurred. So I realize that we can't legislate compassion or empathy or some basic human kindness. I also realize that our coroners are elected officials that have to answer for their actions. However, I believe it's important that we provide our coroners every educational opportunity to know how to deliver the worst news a family may ever hear in their entire lifetime. And I reached out to my own Clark County coroner, Robert Gayhart. I asked for his input on how this could be accomplished, and Senate Bill 66 is the product of that work. I also got a phone call from the Coroners Association with some requested changes, and those have been included in the bill. It basically adds language to coroner training that within 3 years of assuming office, a coroner must complete a course of at least 4 hours provided by DOCJT that includes instruction of the grieving process and best practices for providing a notice of death to next of kin. If a coroner has already completed the course, they're not required to retake the course. And there's also language in the bill regarding the actual notification process. If the decedent's next of kin is out of their jurisdiction, then the coroner only needs to notify the coroner or the official in that jurisdiction. If the decedent's next of kin is in their jurisdiction, then they need to notify emergency medical personnel that a notification is going to take place and confirm that they can actually respond, because you can imagine when you receive that kind of notification, people often have medical complications that can happen. So for the notification, they need to arrange for another person to accompany them, like a deputy coroner, law enforcement, clergy member, grief counselor, or another respected member of the community to help. And they have to provide the information orally in a respectful manner, assist the next of kin in contacting family or friends if they're alone, provide information regarding the handling of the remains, contact information for the coroner's office, and information for grief counseling. And they also should conduct a follow-up a communication within 48 hours. That's basically what the bill does, and I would kindly ask for your support.
Motion on the bill.
We have a motion and a second on the bill. We do have a few questions, and I just want to express my sincere condolences. And I mean, this is heartbreaking news. I can't imagine. But to receive it in the manner that you received it is unconscionable. And I just want to thank Senator Alvarado for bringing this legislation to us, and for really looking at ways to provide better services for families. It's really unbelievable that this sort of thing can happen. So thank you for this legislation, and I'm just very, very sorry for your loss, and I appreciate your advocacy, though. I think this will help a lot of families. Mm-hmm. Thank you. We do have some questions. Representative Prunty.
Thank you, Madam Chair. I want to echo the Madam Chair's comments to you all. I have a question.
why wait 3 years? Why can't it be sooner?
Well, again, we want to get something that's going to be effective. And Coroners Association had some weigh in on this. The original language, I think, had 8 hours of training. They said often we can't talk about that as long. They want to have something that can be done. I learned that the coroners have options every year, like we do for medical education, continuing medical education, that most of the coroners don't seek out this kind of medical education. They're more interested in reimbursements, how to handle bodies, investigations, that sort of thing, which a lot of our coroners do a lot of really rough work. But again, some of this, frankly, in my opinion, is common sense. And again, we can't regulate, compassion or empathy and sometimes in what these folks do, they get deadened. They see some very graphic images, scars on your mind that haunt you that you can't get rid of, that they often become deadened to that, and they forget that the people that are receiving news on the other side don't have those exposed to those things. And, being a physician, I've had to deliver bad news to lots of people. And again, those memories haunt me. People that you tell some bad news, and people that have a rough time hearing that, and those cries and things you carry with you the rest of your life. So you have to know how to deliver that and put yourself in other people's shoes, and that's all it would take sometimes. But hopefully this education will at least inform a lot of these folks that when they hear it, they think about that before they deliver the information.
I definitely support it. Thank you.
Yeah.
Thank you.
Representative Dotson.
I could feel your pain as you were speaking, and very emotional. But I want to commend you for the courage to bring this piece of legislation, you and your husband both, to us, and it's something that needed to be addressed. I worked at the University Medical Center for many years as a level 1 trauma tech, done radiology, and we see a lot of death. We've seen a lot of things that we had to be around families to share the news, and it never got easy. Never got easy. And thank you for sharing your son with us today. He's a beautiful young man, and I pray that God's grace will cover you.
Thank you.
God bless.
Representative Wilner.
Thank you, Senator Alvarado, for this. It's very moving, and I just want to echo what some of my colleagues have already said, and to thank you for your courage today. And facing this news in the best of circumstances is still the most horrifying thing that could happen for a parent. And I hope you can find some comfort that your son will have a legacy through your advocacy, that no other family has to receive this terrible news in the heartless way that you received it. So I just cannot thank you enough for what you're doing for families across Kentucky. Thank you.
Representative Bentley. Okay, thank you. We have a motion and a second on the bill, and I don't see any further questions. Certainly, again, thank you so much for your courage and your advocacy. Madam Secretary, please take the roll.
Representative Bentley? Representative Bowling?
Thank you all. Yes.
Representative Bray?
Yes.
Representative Birch? Representative Dotson?
Yes.
Representative Elliott? Representative Fleming? Representative Frazier Gordon? Representative Marzian? Representative Gibbons Prunty?
Yes.
Representative Rayburn?
Yes.
Representative Raymond?
Yes.
Representative Riley?
Explain my vote. 45 years ago or so, I was coming home from school as a junior, and there was a car in front of me that was weaving, and I could tell I knew who the driver of the car was, and they had an accident. And so my brother and I rushed to the car, and when we got in there, we noticed who was in the car. We knew them. The girl in the back seat, it was obvious that she was deceased. The accident happened less than 100 yards from her house. And I had to walk down to the house, and I got with her older brother, and I said, your sister, I got him, I said, please come outside. I said, your sister's been in a car wreck up here, and it's pretty bad. And they had a bunch of other little brothers and sisters. I said, please keep them here, and you need to go up there. And I knew the family, but I wasn't related to them. And I can still dream that 45 years later at night. Sometimes I dream of that incident. I can't imagine the pain that you guys have gone through, because I know the feeling of that with someone that I just knew. And God bless you for what you're doing, and God bless you for what you're going to do. And I pray that God gives you strength and mercy the rest of your life. Thank you. Yes.
Representative Sharp.
I'd like to explain my vote, please. I'm an aye, and I have a similar experience as Representative Riley, and I really find it hard to believe that there's no protocol for this already. So I am a definite aye on this. Thank you.
Representative Sheldon.
Absolutely, yes. And again, thank you so much for being here.
Representative Tate.
Thank you. Yes.
Representative Weber. Representative Westrom.
I read the article when it came out in the paper, and I was absolutely stunned. And all I can say is you are two extraordinarily remarkable people. And I thank you for reaching out to a very powerful senator who could make this happen. I vote yes.
Representative Wilner.
Yes.
Chairwoman Mosher.
Yes, ma'am. I have one question. I think that we could amend this to call this Nathan's Law.
That's in the text.
Is?
Yes,
Okay.
yes, ma'am.
Okay.
It is. It's
well,
there.
we don't need that then.
Yes.
Thank you for thinking of that, because I think this is a very important way to honor your son. So thank you. Senate Bill 66 passes with favorable expression. The same should pass on the House.
Thank you, Madam Chair, members of the committee.
Thank you. Okay, next we will take up Senate Bill 276, and I see that Senator Neal is with us. Thank you for being here, and we look forward to hearing about sickle cell disease and up-and-coming treatments.
Thank you, Chairman Moser and members, and thank you for hearing this bill. Senate Bill 276 requires the Cabinet of Health and Family Services to conduct an annual review of all medications, services, and treatments for sickle cell disease that are covered by Medicaid. And the purpose of the review is to determine if the covered medications, services, and treatments are adequate to meet the needs of Medicaid beneficiaries who have been diagnosed with sickle cell disease. When conducting the review, importantly, the Cabinet is required to specifically solicit and seek input from the general public and individuals and groups with knowledge and experience in the treatment of sickle cell disease, and a report's required for LRC. I might want to point out that this is the brainchild of the National Black Caucus of State Legislators and the Kentucky Legislative Black Caucus, and it was passed in Tennessee, and the bill we have here is patterned after that particular piece. And I also would like to point out, if I may, that the bill will be cited as Emily's Law, and that's Emily Bass was an individual that was my page here who succumbed to sickle cell disease. So,
thank you so much for bringing this legislation before us and for naming this for Emily. I know that this is a really important issue. We do have a motion and a second on the bill. Representative Bowling, did you have a question? Okay.
Thank you, Senator, for bringing this, and I look forward to voting yes here in a few moments. But, and I might have missed it at the beginning, but how many individuals in Kentucky have sickle cell?
Chad, do you have?
There's 650 is what the estimate is right now. So,
okay.
yeah.
And is there any data that shows, like, on average, how many per year are diagnosed?
Well, the average age, for a person with sickle cell right now is about 38 to 45 is their lifespan. And then a lot of the facts on what are some of the costs associated to it. The average cost for a typical person that has sickle cell is about $700,000 a year. Mm-hmm. The high end for people that have a lot of issues, $4 to $5 million. So there's some real variance in the degree with which they're dealing with sickle cell disease.
Very good. Thank you.
Mr. Grant, I don't think you identified yourself, just for the record.
Chad Grant, Grant Consulting Group, and Clark County resident.
Perfect. Thank you. Okay. Representative Bentley.
I'm probably one of the few people here, thank you, Chair Lady, that has treated patients with sickle
Will you
cell.
pull your microphone a little closer, please?
Yes.
Thank you.
I said I'm probably one of the few medical people here that's treated sickle cell anemia. And I had two brothers, and man, they went through the pain. I stayed right with them. And the expense, there was never a month they didn't have over $1,000 worth of prescriptions with me. So thank you, Senator.
If I may, I just want to thank Chad Grant here, who has given tremendous support to this particular effort and provided significant input, and it's made me and others aware of gains that have been made in the treatment, and I think there's a hope in the field.
Yeah, if I could just add one thing, I'll be brief. I'm hoping to set the stage for the interim to talk a little bit more about some of those therapies we're talking about that can help things like sickle cell disease. One that's on the forefront right now is gene therapies. So basically taking someone's DNA and using a process of disrupting it, deleting it, and then correcting it to actually fix the underlying problem, not just treating, the symptoms. So I hope to come back. I'd hope to have the chief medical officers and some of those folks come and give a better explanation for the House and the Senate folks. But it really is. It's groundbreaking, and there's a lot of FDA pipeline stuff that people should be aware of. So I'll hand it back.
Excellent. Okay, and the goal of this legislation is to put a review process in place, and so we will be getting some of those reports. So I think you're right. Okay, we have a motion and a second on the bill, and I see no further questions. Madam Secretary, please take the roll.
Representative Bentley? Yes. Representative Bowling?
Yes.
Representative Bray?
Yes.
Representative Birch? Representative Dotson? Representative Elliott? Representative Fleming? Representative Frazier Gordon? Representative Marzian? Representative Gibbons Prunty?
Yes.
Representative Rayburn?
Yes.
Representative Raymond?
Yes.
Representative Riley?
Yes.
Representative Sharp?
Aye.
Representative Sheldon?
Yes.
Representative Tate?
Yes.
Representative Weber? Representative Westrom? Representative Wilner?
Yes.
Chairwoman Mosier?
Yes. Okay, Senate Bill 276 passes with favorable expression, and the same should pass on the House. Congratulations and thank you.
Thank you very much.
Representative Dotson, would you like to record a vote?
Yes, I'd like to record a yes vote, please.
On Senate Bill 276?
Yes, ma'am.
Just to clarify, thank you. Okay, is there any other member who needs to record a vote? Okay, I think we're good. Next on the agenda, we need to have a legislative hearing on the 2022 Social Services Block Grant and the preliminary state plan. And I know that we have Laura Bagan online with us to help answer any questions that we have from the membership from the committee. So welcome, Ms. Bagan, and if you can unmute yourself. I think we just want to, I would like to just get a very brief overview of the block grant, kind of what, if you could summarize really what this covers, that would be, I think, helpful to the committee.
Yes, ma'am. Good afternoon. My name is Laura Beacon, and I'm here today for the Department for Community-Based Services. The department administers 5 federal block grants ranging in topic from child care to low-income energy assistance. And the one that we're talking about here today is the Social Services Block Grant. This funds such services as adult protection, child protection services, juvenile justice services. Actually, about 1/3 of this grant goes directly to, passes through us and goes to the Department for Juvenile Justice. This is an annual submittal that we're required to make to the federal government in order to receive these funds. And this hearing today constitutes the public hearing requirement that we have for this grant prior to submitting the final plan. So yes, everyone should have a copy of the preliminary plan, or it's available on the LRC website under meeting materials. And I'd be happy to answer any questions that you have. Thank you.
Thank you very much. I appreciate that summary and just educating us a little bit. I know that we all got the multi-page kind of overview, and I actually did read that last night and this morning. And so I have a couple of questions. I noticed that there was a substantial increase in the in the administrative cost in the plan compared to 2021, and that we're funding more staff trainings. Can you talk a little bit about what these resources are being used for? I thought it was really notable that this year's non-federal estimate is $77 million, and last year's was $19 million. I think those are administrative. You can correct me if I'm wrong, but that's almost a $58 million increase. Can you talk about what that is?
I don't have that on hand specifically right now. I do have someone else on the call with me, Ms. Tracy Desimone, that may be able to answer that relating to training costs, but if not, we'll be glad to go back and get that information for you. Tracy, do you know specifically what is being referred to in this instance?
Hello, Tracy Desimone with the Department for Community-Based Services. I don't. We can get that information for you.
Okay, that would be really good. I just that's huge. I wonder if that's federal or state or what we're talking about here. And then I had a question about what specific child protection services are funded through this grant. Almost $32 million more in non-federal estimated funds compared to the 2021 preliminary plan is what I noted, and I'm just wondering if you can help me out with that.
Sure. So the child protection services covered by this grant would refer to everything that falls under that, including care of children in out-of-home care, children in the state's custody. So that would be everything from investigations for child protective services, manning that hotline, to, again, the care that's provided, which would be foster care payments, other relative care payments. So that definitely is the largest part of this grant, especially for the state funds that we tell the federal government that we're contributing to as well, in addition to the federal funds received. Yes, child protective services, the cost of children out of home care is huge. And I know that you've heard and have been very supportive of our endeavors around child welfare prevention, so that we can spend more money on the front end, reduce the trauma to families, but also really reduce the cost of the services that we're providing after trauma has occurred, associated with removing a child from their home and placing them into other arrangements.
Okay, yes, thank you. I certainly understand that and all of the downstream effects of entering the foster care system, but this is a really substantial increase. And so I look forward to hearing the positive outcomes from all of the great things that are going to happen and the changes that we may see with this increased funding. Do we have any other questions? Representative Prunty?
It looks like a third of the federal funding is passed through the Department of Juvenile Justice. What kind of projects go on through juvenile justice? Can you expand on that a little?
I don't know what they are currently doing, and I'll see if Ms. Desimone can provide that as well. We haven't been asked that specific question before, but we would have had someone from their department accompany us. But Tracy, do you have that information on hand?
Not details. I know that a lot of it goes toward working with our kiddos who are in out-of-home care that are served by DJJ, but I don't think I can speak to the specifics today. We can find that information.
Okay, thank you.
Thank you. Yeah, I'm sure that we could help you come up with ideas on how to spend that money if you want us to do that. I do know that restorative justice is a pilot that is being introduced through the state, and I think that would be a very important program to look at in terms of the juvenile justice system. So just putting that out there. Do we have any other questions? Okay, seeing none. I just wanted to make sure that our committee reviewed this in a timely manner, and I want to thank you for being here with us today and certainly providing the information. And I wanted to make sure that anyone watching is aware of what we are working on in the state. So, Representative Frazier Gordon, do you want to record some votes?
Yes, please. I would like to record yes votes on Senate Bill 66, Senate Bill 68, Senate Bill 173, Senate Bill 178, and Senate Bill 276, please.
Okay, thank you very much. I want to thank our staff and for all that you do to make these meetings run smoothly and help us pass good policy here in the state. As far as I know, this is our last meeting for the session. Crazy things happen, and sometimes we have special meetings, but for right now, I just want to make sure that we thank both Hillary and Deanne and everyone else, Chris, everyone who puts up with us and late night emails and all that we demand of you. So thank you very much for everything you do. Okay, seeing no further business to come before this committee, we are adjourned.